That's a really good question. And whether it's easier or more difficult to design for dementia than in recent years can't be answered with a yes or no. Our understanding and knowledge of dementia design has without a doubt increased over recent years, and we've witnessed an increase in the number of research projects and papers being published in this field. We've also saw an uplift in the number of organisations and individuals who are engaging with the design principles and adopting them in their own environments. So on one hand, there is more information available for people, so one could assume that by virtue of access to this information that the task is made easier. But conversely, this can also make it more challenging, because it can also, and quite often, be the case of the more you know, the more you realise you don't know. So for example, within the UK, for the first time in design history, we have policy that legislates for the built environment to be fully inclusive, physically, cognitively, socially, etc. And the technical research which underpins the concept of, let's say, contrast is now so advanced that we have a definition of what contrast actually is, and it's published in our building regulations. So where previously designers designing for dementia would aim for contrast or no contrast as a concept of colour, they're now aiming for a numeric percentage variation of light reflectance. And so one must also design to include the technical considerations where the research evidence has sufficiently been developed to be able to quantify what that is. So the challenge to design for dementia now is that the metrics for assessment are far more specific, and in addition, to add a further layer of complexity, the evidence base to support this is still evolving, which means that we're all working on the best of our knowledge as we understand it today and as evidenced in the research today, and that's great because that's what we should be doing. But the research which we're undertaking now will inform dementia design principles and recommendations for tomorrow. And that's going to be a continual challenge of learning and staying up to date with the most recent research. And that can be hard. And that's why we have the need to publish and to share knowledge on all of the research projects that the universities undertake. The global pandemic has brought a sharp focus to airborne infection control precautions and the need to understand infection control as something beyond surface contact. I find this of particular interest because airborne transmission in the environment requires understanding of how the environmental design of these spaces and the air movement and mechanical ventilation systems which form part of the wider architecture all influence the spread of infection and the infection control response. And unlike contact precautions, measures to support a reduction in airborne infection tend to rely on the overall design of the building, so its superstructure, its plan layout, orientation of rooms, the mechanical or natural ventilation that's available. And these are typically considerations at the very beginning of a design project and are not something which can be managed retrospectively in a retrofit approach or through, for example, the operations of cleaning surfaces. So I suspect the design of our care settings will change in years to come once the lessons of this pandemic are really fully understood. In the UK, we know that 2/3 of people living with dementia are living within the community, and that the remaining 1/3 are living within care settings. And through consultation and research over the years, we know that people living with dementia want to live their best possible lives within their own home. So to deliver on this need, we need to build houses which meet the demands of an ageing population and the physical and the cognitive challenges which ageing brings. During the pandemic, cities across Europe changed their infrastructure and public spaces to be able to accommodate social distancing, active travel, exercise, provision of services and access to amenities and health provision, and they did so in a much more localised approach. They were required to because of the distance restrictions that were in place during lockdown measures. And the emergence of the 15 or the 20-minute neighbourhood as a planning concept took seed. And this concept of the 20-minute neighbourhood is where people can meet their essential needs within a 20-minute walk. This is in direct contrast to the urban planning policies which have dominated for the last century, where planning zoning was separated by business, industry, residential, and we had an over-reliance on vehicular movement and car transportation. The focus of the 20-minute neighbourhood is all around health, well-being and local connectivity, and these concepts are inherently dementia-friendly. And so if we're able to transition to this type of urban planning approach and we develop housing which achieves this with access to all of the necessary amenities and health and care provisions within a 20-minute walk, we will help more people with dementia to live more independently within their own communities. Sustainable design practices are a key consideration for many architects and designers, and like so many other aspects of their brief, it's something that has to be agreed at the outset of the project. It needs to be managed through the design development, and there needs to be a commitment made by all parties to deliver on it. We've witnessed an increase in demand for sustainable products and building practices across the sector, and this can impact on projects which require environmental performance accreditation along with dementia design accreditation. So we've had experience of this, and our learning from that is the best way to manage potential conflicts between building accreditation systems or legislation is to engage early in the process and to mitigate conflict later in the design process, where if you have to make changes to the design or the specification further down the design development, you're more likely to incur cost and it's likely to increase the amount of time it takes to make that change. So as an industry, construction is moving simultaneously towards inclusive design and sustainable design. And so it's important that both can be achieved without really having to compromise on either of them. Thank you so much for having me. It's been a real pleasure to be able to talk with you today.